Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Stephen Routon, and he is a board-certified radiologist specializing in breast imaging at CARTI. Dr. Routon, thanks for being here.
Thanks for having me.
So we're talking about contrast enhanced mammography. Tell us what that is and how is it different from traditional mammography?
For lack of a better term, it's a better mammogram. So mammography is the gold standard, and it has been, I think it will be going forward in the future for breast cancer screening. Contrast is just an add-on to it. So any woman who's gotten a mammogram before won't notice much different except the before, where it's just a small IV and a little contrast injection. And then we do the standard mammogram view. So it allows us to see a little bit more, enhances our detection, and helps a certain subset of women who may benefit from a little additional screening besides just your standard mammogram.
And this is new to CARTI. Why has the practice started implementing this type of mammography?
Yeah, so it's new to CARTI, and we're the first in the state to implement it. So right now we're offering it at two centers, our breast center in Little Rock and in El Dorado, and we'll likely be expanding that in the future. It's a newer technology. It's not brand new. It's been on the market. It's been FDA approved. And anytime anything comes out, there's going to be a little lag time, and just for us to get to know it too and see. And I've been searching for these, additional modalities and things that might just offer the absolute best for patients.
How does the contrast agent enhance the imaging process? What type of lesions or conditions does it help reveal?
So, contrast isn't new. It's new to mammography now with this, but it's not new to imaging. So a lot of people have had CT scans or CAT scan and gotten a contrast injection or MRIs of any part of the body. And typically contrast is involved there. What it does is contrast is taken up by different parts of the body a little bit more and can show up. It enhances the image quality. And so the science behind that with mammograms are that masses in the breast and some forms of growth can take up more contrast and so they show up brighter on the mammogram. Typically what we've been looking for on the mammogram is just masses and calcifications and things that stand out and things that change over time. This contrast allows us to look and say, hey, what might be more active and taking up that contrast?
And how long does this entire procedure take? Is it something that's super quick in and out, or does it take a little longer?
Just a little bit longer than the standard mammogram. So most appointment times, you'll probably be in and out in about a half hour. So, and like I said, it's the same. So most women that have had a mammogram before aren't going to notice much different once we get to the x-ray picture side. The same compression, the same mammogram, if they've been to CARTI, it'll be the same room we've done it in. It's just beforehand we start that IV, the contrast injection goes pretty quickly, and then afterwards we just observe for a few minutes just to make sure everything's fine and no one has a reaction to it.
And is this for women that have dense breast tissue, or does that matter?
Yes. So, and with any new screening, I'll tell people that not everybody is going to need that. Yes, we have certain patients that need what's called supplemental screening. And so like I always reiterate that mammography is the gold standard. And I say that to say that one of the misconceptions I always want to fight when there's new technology is to say the old one isn't bad. So mammograms are still the gold standard. The 3D mammograms, we do those on everyone at CARTI. You're always going to get those. With the contrast, we offer it to a certain subset. So not everyone will need that. Yes, women with dense breasts will qualify for this type of screening and women that are high risk. So some women that had elevated risk factors, maybe they've had genetic testing or they've had previous biopsies that were abnormal or family members. Or even women, we'll use it in the diagnostic setting for some women that have newly diagnosed breast cancer that we might stage disease. So there's a lot of utility that, some of our patients may not necessarily need it, but we are going to have a lot that are going to qualify.
And how does the sensitivity and specificity of CEM compared to an MRI or an ultrasound?
It's very comparable to MRI. And it's better than that of ultrasound. And so, yeah, the sensitivity is more. So over 97% of breast cancer is going to be detected by this. And so that's the first thing we always talk about. And with any imaging modality, right? If someone has breast cancer, we want to find it, and we want to find it early. And this helps us. The thing I like about this, too, is that the specificity is also very high. And so that's also the other thing I'll say, that most of my patients, thankfully, are going to be normal and they're not going to have breast cancer. And that being said, I want to be confident that they're normal and not have to work up findings that may be just inconsequential to the patient. So that's why I really like this, not just to be able to detect things, but to be able to say, hey, when we're comfortable with the mammogram, when we're not seeing anything, we know that our patients are okay.
Are there side effects? Do you see things that are a little bit different than, say, other contrast type imaging?
The main side effect to worry about is if anyone has a history of an allergic reaction. And a lot of people will know that because, like I said, many people have had contrast just from a CT scan or an MRI. So that'll probably be our first question that we ask people. Have you ever had a reaction? And tell us what it is, because there's various different types of reactions. So the main one is a contrast allergy. The other things that are just side effects, and I've had contrast, so I can speak to it, is you may feel just a warm sensation when it goes in, and that goes away in a few seconds. And some people report a little metallic taste in their mouth. Those are usually done by the time the exam's over.
Should patients with like kidney issues or allergies, you mentioned that about allergies and watching that with the contrast, is there other issues that you will look for or they should be concerned about?
Mainly allergies, and then yes, renal issues. And so we may check if you've had labs recently, or we can run a quick one just to check your renal function and make sure it's okay and that you qualify.
And you have some success stories, cases where CEM has made a difference in early diagnosis or treatment planning? Right now,
because we haven't done many cases, the success stories really are on that negative predictive value, that specificity, where we've worked up some patients that had some findings that showed up on imaging, and sometimes the ultrasound can look a little suspicious, or the mammogram can change. There's a lot of questions, and some patients we might have jumped to biopsy, where we've been able to do contrast and say, okay, this finding is okay. We don't have to, and we've saved the patient a procedure, and we know she's okay. We will see it. I know after we roll this out, we'll be seeing some cancers, and just going to continuing ed courses, I was amazed at seeing some of the cases they were able to find that I never would have, or it would have been later on before we would have been able to find them without contrast.
And you touched on this a little bit. Who qualifies for this exactly?
So the main two groups of patients that will qualify are women with dense breast tissue and women with elevated risk factors. Some patients come in knowing that they have dense breasts, or knowing, a lot of people will know that they have high risk factors, because it may be from family history or so. But those are also things we're going to screen for, and we're going to ask. Always, we ask about family history. We have a lot of patients who ask us about genetic testing and go for that. With dense breast density is a thing that I have to notify every woman by law of, do they have dense breasts or not? So you're going to get a letter from me, and about 40% of my patients, 40% of U.S. women have dense breasts, and so they'll get a letter telling us they have dense breasts, and those are the main types of patients that qualify for this.
Does insurance cover this?
So it's hard to speak with all the health insurance plans out there. Generally, for diagnostic purposes, it should be covered. But yeah, that's just really going to be plan specific for patients.
And what future developments do you see for contrast-enhanced mammography or breast imaging more broadly?
What I'm most excited for is in the broad screening for women with dense tissue, and that's always been a more challenging area of mammography. I always tell my patients that I've been in practice 11 years now, but it was great that when I trained, I got to see so much of the evolution of breast imaging. I mean, we hung films, so old films, and reading a woman's mammogram with dense breast was very tough. And then I saw the jump to, very soon when I was still in training in residency, to digital mammograms. And then right after I finished, we went to the 3D mammograms. And those jumps were phenomenal. Still with dense tissue, it can be concerning to people because I'll have some patients say, well, I hear the mammogram is not as good. And I'll say, 10 years ago it wasn't, and now they're really great. But we still offer additional tests. Right now we do whole breast ultrasound. What I've been looking for is, what's that good test that really helps me out in patients with dense breast tissue? And also, on the flip side, doesn't take as much time as, say, an MRI might be, if they don't qualify for MRI, and won't have the rate of false positives where we have to put people through procedures or more workups when we're trying to help them and screen them. And every new technology, I'll tell people, I'm a skeptic. It usually takes me a few years and a few I don't go to a course and say, okay, I love that, I want to implement that. And there are certainly tons of articles that I'll read in the literature where I think, I don't know that I like that. And this one, I've read a lot about it over the past few years and finally went and did some training on it and thought, this is what I've been looking for. This is that happy medium for my patients with dense breasts. And then also I have patients that we get MRI screening of that can't do it. Some women have pacemakers. Some women are claustrophobic. And I don't want to make them, get in that magnet. That's not just the easiest test, or they have other medical devices or can't have the MRI contrast. And this is going to be a great tool for some of those patients that can't have or just don't want to get MRI. It's going to really help them.
Well, Dr. Routon, thank you so much for talking about this important information. What lasting message would you like to leave with our audience about CEM and the progress that you're seeing in the field?
The main thing, and it's my soapbox that I always say, is mammograms every year. So I tell all my patients, the best thing, and the reason we're so successful at treating breast cancer is because I'll tell patients, I want to find it when it's early and when it's small. I wish the mammogram just zapped it and prevented it. And every woman is going to be affected in some way by breast cancer. And I'm not necessarily saying personally, but it may be a friend or family member. Everyone knows someone and has someone close to them that's affected by breast cancer. And the only way you can treat it is if I find it and find it early. So I always say every year, and I try to be aware of that, right? Being a guy, that I having to go through that, I'm a big cheerleader for it and encourage my patients every single year, beginning at age 40. And then the technological advances are great. They help our confidence. They help us find things earlier and detect them better. And the thing I really love the most that impacts patients on a day-to-day basis is we don't have to worry about things that don't need worrying about.
Well, thank you. Thanks for being here today.
Yeah, thank you for having me.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.